Assalamu alaikum. Today I discuss the clavicle. It is a modified long bone. It Why it is modified long bone? Because it is the only long bone which plays horizontally. It has two end, medial end or sternal end. This is acromial end or lateral end. It has a shaped shaft. It has no medullary cavity. Every long bone have medullary cavity and it has only secondary ossification center. There is a lot of peculiarity present within this bone. First peculiarity, it is the only long bone which placed horizontally is devoid of medullary cavity. I already discussed. It is a long bone but it ossifies from membrane. Most of the long bone is ossified from cartilage. So cartilaginous ossification, but its ossification is membranous ossification. It is subcutaneous throughout its length and it may be pierced by a nerve. Name of the nerve is supraclavicular nerve. The site determination of the clavicle. At first you find the medial end. It is thick and rounded and it is placed medially and flattened lateral and directed laterally. The superior surface and inferior surface you can identify. Superior surface is smooth and inferior surface present a groove for subclavius muscle. Medial 2/3 of the shaft is convex anteriorly and lateral 1/3 is concave anteriorly. So by this you can determine the side of the clavicle. Joint related to clavicle. This is sternoclavicular joint, saddle type of synovial joint. This is acromioclavicular joint. This is plain type of synovial joint. So this is sternoclavicular joint. It is a saddle variety of synovial joint. Speciality of this joint cavity containing a articular disc divide the joint cavity into two parts. The medial 2/3 of the clavicle is cylindrical and it has four surfaces: superior, inferior, anterior and posterior surface. But lateral 1/3 is flattened, so it has anterior border, posterior border, superior surface and inferior surface. The attachment of the superior surface. Superior surface is smooth and is covered by skin platysma muscle and medially provide a attachment of sternocleidomastoid muscle. Inferior surface has a rough impression near its medial surface which provide attachment of the costoclavicular ligament. A shallow groove is present which provide attachment of subclavius muscle and clavipectoral fascia is attached to the margin of the subclavius groove. Subclavian groove. The posterior surface is smooth and concave posteriorly and is related to the trunk of the brachial plexus and subclavian vessels. Medial end of the posterior surface provide attachment of the sternohyoid muscle. Behind the clavicle, the lower trunk of the brachial plexus and also the divisions of the brachial plexus is related. Near the medial end of the posterior surface of the clavicle present another attachment of the muscle. This is sternohyoid muscle. Now the attachment of the lateral one-third of the clavicle. The anterior border is concave anteriorly and provide attachment of the deltoid muscle. The posterior border is convex posteriorly and provide attachment to the trapezius muscle. The superior surface is mostly smooth. The inferior surface has conoid tubercle near the posterior border, a thick ridge present, trapezoid ridge extending forward and laterally from the conoid tubercle. They provide attachment of the conoid and trapezoid part of coracoclavicular ligament. So this is the conoid part of the coracoclavicular ligament and this is the trapezoid part and this is acromioclavicular ligament. Now the ossification of the clavicle. Most of the shaft is ossified by a membrane except for the medial and it is ossified from two primary ossification centers for shaft and this appear during 5th or 6th week of intrauterine life. It is the first bone which ossify and it is the last bone which end its ossification process. It has one secondary ossification center for the medial end which appear at the age of 15 or 20 years of age. This fuse with the shaft within 25 years of age. Now clinical anatomy related to clavicle. Cleidocraniodystosis or dysplasia. It affects mostly bone derived from the intermembranous ossification such as cranium and the clavicle. It is characterized by delayed closure of the cranial suture, hypoplastic or aplastic clavicle and multiple dental abnormality. What is the most common site of the fracture of the clavicle? The junction between medial 2/3 and lateral 1/3 is the common place fracture is occur.